Now we shall move about to discuss about the most common cold injuries that the worker sustains when he works in a cold working environment. This would be the pathological mechanism that a worker goes through when he's in a cold environment. There is initially a fall in the skin temperature, which in turn is followed by a vasoconstrictive mechanisms, piloerection, an increase in the basal metabolic rate of the worker. When there is a sustained and continuous peripheral vasoconstriction, there is a fluid shift and a decrease in the plasma volume, which leads to shivering. Even if it continues after that, there would be exhaustion of the shivering mechanism and it tails off gradually, which then followed by a gradual rigidity and imminent death if the treatment measures and the first aid measures do not occur now. These are the warning signs of hypothermia. Initially, you will have confusion, you will have shivering, there will be a difficulty in speech, a mild drowsiness, followed by the muscle stiffness. Workers who are at risk to develop cold injuries: airline maintenance cabin crew people, workers working in a cooling room, drivers, military personnel who are working in high altitude, miners, workers in a warehouse, and workers who are working in a forest. All these workers are more susceptible to develop cold injuries. This table will explain the amount of exposure limits for various temperatures. Here I have given the temperature in degree Fahrenheit. When the working environmental temperature is between 30 degree Fahrenheit to 0 degree Fahrenheit, there is no limit of work time if the worker is properly clothed. If the temperature is between 0 degree Fahrenheit to 30 degree Fahrenheit, the total work time should be restricted to 4 hours, alternate 1 hour of work and 1 hour outside the chamber. If the temperature is between minus 30 degree Fahrenheit to minus 70 degree Fahrenheit, the total time of work should be restricted to 1 hour, 30 minutes each with 4 hours apart. If the temperature is between minus 70 degree Fahrenheit to minus 100 degree Fahrenheit, the maximum permissible work time is only 5 minutes in a total of 8-hour working day. Cold-induced injuries are mainly due to the inability of the worker to protect himself properly from the environment which is cold. There is local cooling of tissues followed by tissue anoxia and lowering of the core body temperature. The types of cold injuries include systematic and local injuries, and they can be classified as freezing and non-freezing injuries. Now this flowchart will help to differentiate you among the various types of injuries. Cold illness are classified as freezing injuries, non-freezing injuries, and hypothermia. Freezing injuries are further classified as frostnip and frostbite. Non-freezing injuries can either be chilblain or trench or immersion foot. Hypothermia is categorized as mild, moderate, and severe. Frostbite, which is a freezing injury, is further classified into superficial, severe, or deep variant. This is what I have already told you in the flowchart. Freezing injuries include local freezing of the tissues, which is rapid and dramatic in onset. The most commonly affected areas include fingertips, toes, nose, cheek, and earlobes. It is mainly due to high concentration of electrolytes in the body fluids, which is as a result of vasoconstriction due to an decreased environmental temperature. The first one is frostnip. It is a form of mild freezing cold injury. There is a loss of peripheral sensation and freezing of the superficial tissues of our body. The treatment is rewarming. The recovery time of the worker is usually 30 minutes after the onset of the treatment. Rubbing, massaging, and application of the direct heat to the affected parts of the body should be avoided. The next one is frostbite. It is a severe form of freezing injury. It can be further categorized into 3 different types, which is superficial, deep, and complicated. Superficial frostbite is confined to the skin and the peripheral layers. There will be gross discoloration of the tissues, blister formation and appearance of hemorrhagic patches, patches of dyed gangrene. It appears black in color. This picture will show you the various degrees and various types of frostbite that are commonly encountered. In initial stages, you can very well appreciate the reddish discoloration at the tips of your fingers. Then the tips will start becoming pale in color. There will be development of blisters. At the 4th degree, with the onset of dry gangrene, the tips will start becoming blacker in color. The next one is deep and complicated frostbite. It involves muscles and the deeper tissues of our body. The victims are usually hypothermic, and if the rewarming is attempted rapidly in a hospital environment, which is more important, recovery is ensured. And we have to make sure always a rapid rewarming is attempted in a well-controlled and a well-equipped setup. Tissue decompression is always advised prior to the rewarming in order to reduce the pressure of the tissues. Preventive mechanisms such as giving a prophylaxis for tetanus, development of gangrene, and preventing the secondary infections with antibiotics. Pre-administration of antibiotics is always administered, is always advised in case of complicated frostbite. There is something you mandatory need to know about is a freeze-thaw refreeze injury, which involves 4 stages. In this, there is more destruction to the tissue cells and it results in early amputation of the part of which is affected. The 4 pathological stages here includes a pre-freeze phase. This appears prior to the crystal formation stage. You have vasospasticity and endothelial leakage in this phase. The temperature will usually be between 3 to 10 degrees Celsius. The cutaneous sensation are absent for the workers. The second one is the freeze-thaw phase. This is the stage of actual crystal formation in our body. The tissue temperature starts falling below the freezing point. Endothelium, bone marrow, and the nervous tissues are the most commonly affected and the most susceptible structures in the freeze-thaw phase. And these 3 are the most common tissues that are first affected in a cold injury. The third is a vascular static phase. In this phase, the changes are usually seen in the blood vessels. There will be spasticity of the vessels, dilatation, and vascular leakage. In the 4th phase, there is development of thrombosis, AV shunt, and ischemia. This picture will show you the first aid management that are to be advocated in a case of cold injury. Make sure you remove the patient from the exposure to avoid the further exposure and move them to a warm, dry place. Cover their head or head part of their body to retain heat. Help the patient to lie down, preferably in a recumbent position. Give the patient warm fluids. Remove the clothes if they are wet and make sure you cover them with a dry cloth. Use hot water bottles and hot packs for rewarming in the initial phases. Treatment procedure is usually conservative, preventive, and symptomatic treatment. Rapid warming can be done with a water bath. Always remember you have to give antibiotic cover to prevent secondary infections. Tetanus prophylaxis is always advised, and a good analgesic cover using analgesics NSAIDs usually preferred is always necessary. Moving on to the non-freezing injuries. These are mainly caused due to a long exposure to a lesser temperature and is mainly because of circulatory stasis. The common non-freezing injuries are trench foot or immersion foot and shelter limb. These injuries are characterized by cold, ischemic, and numb extremities and injuries. Immersion foot. This is mainly due to the prolonged exposure to wet and cold temperatures. To prevent heat loss, the body starts to constrict the blood vessels, thereby shutting down the circulation to our extremities, mainly to the foot. The skin tissues begin to die due to the lack of oxygen as the blood supply is shut down, and there is lack of nutrient supply to the tissues as well, which results as circulation is shut off. There is also buildup of the toxic products in our extremities. The symptoms usually includes redness of the skin, numbness, cramps in our extremities of the affected part, swelling of the affected part, blisters which then becomes ulcers, bleeding under the skin, gangrene usually appears dark purple, blue or grey in color. The management includes the removal of the shoes, removal of the boots, removing of any wet objects, wet cloth in contact with the body, and advising them to stop walking on foot for some time until they recover from the tissue damage. All these will help. Before the management, ensure all the first aid measures are met. Next one is chilblain. This is usually caused due to a chronic intermittent exposure to high humidity. It is characterized by the appearance of local erythema, cyanosis, plaque and nodule formation. This condition has more chances of recurrence. Management is usually symptomatic and preventive. Hypothermia. In hypothermia, the core body temperature usually falls below 35 degrees Celsius. The common signs encountered in a worker with hypothermia are vasoconstriction, pallor, and muscle weakness. There is usually a loss of consciousness if the core body temperature falls below 30 to 32 degrees Celsius. Sometimes chances of ventricular fibrillation developing in a worker is more common in hypothermia. How do you go about with evaluation and control of a cold injury? Ensure a warm working regimen for the worker. If the temperature is 7 degrees Celsius, heated warming shelters can be used to maintain the body temperature of a worker. But if the temperature falls below 12 degrees Celsius, workers are to be under constant supervision, under constant watch out for the impending injuries that they might develop. Monitor their physical conditions regularly. Advise them to take regular breaks to warm whenever needed. Ask them to dress properly. Advise them to stay dry because to avoid moisture and dampness, that is from sweating, and this can increase the heat loss from the body further. Advise them to keep extra clothing in case if they need to change. Ask them to take frequent intervals of warm sweetened fluids. Advise them to avoid alcohol. Ask them to avoid touching cold metal or wet surfaces with a bare skin, and always advise them to use a proper engineering control. Follow the safety work practices as advised by the safety professionals and make sure they always wear a personal protective equipment. Moving on to workplace monitoring. Use of thermometry if the temperature falls below 16 degrees Celsius at the workplace. Whenever the air temperature falls below 1 degree Celsius, the dry bulb temperature is to be monitored every 4 hours. To sum up, frost nip or frostbite, you will have reddened skin, needle prick sensations, waxy skin sometimes, along with numbness and tingling. This is for the frost nip. If there is trench foot, you will have swelling, tingling and numbness. If the individual develops chilblain, there will be just a skin discoloration and itchiness. If there is nerve damage due to exposure to cold, there will be loss of sensation and mobility. If the individual has developed hypothermia, there will be bradycardia, a lower body temperature and a state of confusion. Sometimes exposure to cold, they develop psychosis which has hallucination, delusions and paranoia.